Today we're going to talk about some frequently asked questions that I always get. One question that I get asked all the time is, what's the difference between a bonding that's done same day in the office versus a porcelain veneer? And it's a great question. Porcelain veneers are made to be intimately fitted to your tooth structure. They're done in a few visits, usually 2, and they're made by a ceramist in a lab, so there's a very intimate fit against your tooth structure. They end up lasting longer, they're more structurally sound, they have life to them, they are able to play with indoor and outdoor light very well, so they look aesthetic and natural. When we have large bondings on front teeth, they really don't tend to hold up very well. They chip, they fracture over time. There's also an element of shrinkage that occurs when they're placed in the mouth, so we end up seeing decay around them or even just discoloration over time. And another thing that's not great with bondings is when they're placed around the gum line, we usually see a lot of tissue inflammation and irritation. And porcelain, on the other hand, is very gum friendly. So usually I'm going to recommend porcelain veneers because they are natural, they are strong, and you get greater longevity out of them. Another question that patients ask me pretty frequently, are there any limitations with veneers if I am to get them done? And the real answer is no. When you have temporary veneers, you really want to avoid anything that would stain a white t-shirt. So you don't want to have red wine, berries, turmeric, things of that nature, because the temporaries are made out of a resin material, so they can absorb that color and material while you're wearing them. And another thing you want to avoid are really hard and crunchy foods when you're in the temporary phase. But ultimately, when the temporaries come off and the porcelain veneers are placed, they are ready to go. I'm always going to recommend that whether you have porcelain veneers or even your natural teeth, you do want to avoid using your teeth as tools. You do not want to use them to open chip bags or to take clothing tags off of things, because then you're really at risk for fracturing your teeth in general. Another frequently asked question that I often get is, are all veneers the same, Dr. Paré? And the short answer really is no. Veneers can be made out of multiple materials. I've already discussed bonding versus porcelain, but even when we break it down into porcelain, there are many different types of porcelain out there, and different dentists choose to use different types for various reasons. In my practice, I typically use feldspathic porcelain. I also use Emax porcelain that is hand layered. And the reason behind that is with the feldspathic porcelain, we're really able to get results that mimic nature. So there's great color and texture and little nuances we can place in the teeth that make them look very lifelike. And that's very important to me. When we're enhancing a smile, I do want it to be beautiful and brilliant, but I want it to look as natural as possible and blend with the patient's lips and facial structure. The feldspathic porcelain or even the Emax porcelain, I have made with my lab with a master ceramist. The master ceramist that I work with makes each veneer by hand. So there is a lot of precision and detail that goes into these veneers, and we end up getting really beautiful results. You can make veneers in the office, but I have found that I'd rather have my ceramist spend the time that's needed delicately crafting these and not rushing it in one quick visit. And another part of this is my patients do wear temporaries for a few weeks, and I want them to be in those temporaries, really to ensure that they like the length and the color and the overall anatomy that we've given them. And it's a trial smile. It's cheesy, but it works. And that way the patients aren't surprised when they get their final veneers. They've had a chance to wear them and make sure that they really love what they're going to get. So when we go from the temporaries, which are a resin material, to the final porcelain, we get a really predictable and beautiful result. And the last frequently asked question that I often get from patients is, do I have to shave down my teeth to little nubs for veneers? And the answer is no. I try to practice very conservative dentistry for a multitude of reasons. We always want to remove very little tooth structure. This ensures that we reduce the risk of sensitivity. This gives the veneers a better long-term prognosis because research has shown us that veneers that are bonded into the enamel last longer. And another great thing about staying conservative is if you have treatment done earlier in life and you need to redo it, or you decide cosmetically to replace it 20 years down the road, then when you take those veneers off, if they are done conservatively to begin with, you still have a lot of tooth structure. And oftentimes you can do veneers a second time and you do not need to go to a full coverage crown that goes 360 degrees around your tooth. When I design my cases, I already have an end goal in mind. When I do the mock-up design, and it's basically where I want your teeth to end up, I have very precise guides so that when I am adjusting your teeth, I am taking fractions of a millimeter off. And it really ensures that we stay conservative and we get excellent results. There are some cases where ultimately we cannot be super conservative, but I have those conversations with patients initially at your consultation. And sometimes we need to intervene and do a little bit of orthodontic treatment first, put your teeth into a nice alignment so that ultimately in the end, we can stay conservative and not take down too much tooth structure.